on the web, and in your hands. This is MDiTV.
If you were tested and told you had high cholesterol, you might expect to be put on medication to lower your level. A new study is challenging that thinking, encouraging physicians to look at several factors before prescribing statins. The message from researchers at the University of Michigan Medical School: knowing your overall heart attack risk is more important than knowing your cholesterol level. In fact, the lead investigator, Dr. Rodney Hayward, says LDL cholesterol alone explains just 9% of an individual's risk of cardiovascular events, and sufficient attention is not given to the remaining 91%. The research published in the Annals of Internal Medicine calls it tailored treatment. It was used on more than 4,000 patients. Here's an example of how it worked. If high cholesterol was a young patient's only risk factor, changes in diet and exercise were considered a better option than medication. Quality of life was thought to improve, since statins can have unpleasant side effects like muscle aches and can also affect the liver. Cardiologists see value in the recent study, since cholesterol levels are routinely just one of many things to consider when evaluating a patient.
Sure. There are several risk factors that we follow. Number one, smoking history, diabetes, family history. For example, any of the family prior to the age of 55 who had heart trouble, and that specifically heart attack. Then we're talking about hypertension and lifestyle.
The age of the patient is also important. The University of Michigan Medical School study looked at Americans between the ages of 30 and 75 with no history of heart attack. With the approach of evaluating all risk factors, fewer patients were treated with cholesterol-lowering drugs. The study says the approach was more efficient and prevented substantially more heart attacks than treating just to lower cholesterol levels. The results can be a confirmation of what doctors have been telling patients.
If a 30 or 40-year-old man comes to me, or lady, and the cholesterol is really out of control, but you look at them and you know they're overweight, they're not eating healthy, but then you look at the risk factors and they really don't have diabetes and no history of heart trouble. Those folks, what I would try to do is be very aggressive, telling them you have to eat healthy, you have to change your lifestyle. So before I prescribe any medication for them, I tell them to change their lifestyle, give them 3 months.
The changes in lifestyle can be a challenge. Doctors point out that while patients used to be told exercising 20 minutes 3 times a week could help lower cholesterol, the current thinking is that it will take a lot more work, for some patients up to an hour a day, 6 days a week. But many patients could be motivated by saving money when they can avoid taking cholesterol-lowering medications. And with the result of this new study, many more may have that option. The author is hoping it will help physicians shift their philosophy and get them thinking more about baseline risk and less about a single number like cholesterol.